I think the mayor is very clever to have you present, I think particularly because of your jurisdiction. So I think that there's some very strategic thinking going on there, which I really appreciate. So it's my great pleasure now to introduce William Galley. And Bill is a good friend. He's also, happens to also be, the scientific director for the Institute of Public Health. Just very quickly, I just quickly mentioned it in my introductions, but this growing of the relationship began with the Institute of Public Health, and we hope to keep on building that. But it was very meaningful for us to have such a critical research institute of the university to join us in this work first. And we're building now, and you're going to hear a lot more of this collaboration in future symposia, but also in research initiatives, which we are working very hard on together. So, Bill.
Thank you, Nancy, and thank you everyone for being here this morning. So as Nancy has said, I'm the scientific director of the Institute for Public Health at the University of Calgary. And I'm up here representing an associate scientific director, Dr. Lynn McIntyre, administrative director, Dr. Jamie Day, and an institute of over 300 members who reside within the Faculty of Medicine, many, but also within many main campus faculties, such as the Faculty of Environmental Design, within Alberta Health Services, and then also within some community organizations, including the City of Calgary. Some of our membership are individuals who have their primary appointments at the City of Calgary. Our institute is one of 7 health research institutes at the University of Calgary, and ours is the newest. The other 6 were launched in 2003, 2004. Our institute launched officially in 2010. And the University of Calgary had in its strategic planning in the late 2000s a plan to launch an Institute for Public Health. And why did they do this? I think the motivation for having public health in an academic institution like the University of Calgary is the recognition that health is a fundamental good. And some groups would go further and say that health is a human right, a basic human right. And we can quote famous individuals such as Sir Winston Churchill, who said, "A country's greatest assets are its healthy citizens," or Gandhi, who said that health is wealth. And that can be modeled economically to show investment in creating a healthy population can lead to tremendous downstream economic benefits. And when we think about health, there are certainly 2 core elements to being healthy. One is predictably to have mechanisms to be treated when we get sick, and that's what health care is about. It's a system that looks after us when we get sick. The other, many would say, more important element to health is to have mechanisms and foundational structures that keep us healthy and that help us prevent disease. And in our institute, we're interested in the study of ways to both have good health care when we get sick and also a strong foundation for healthy populations. And as an institute that's based primarily in the university with partnerships outside of the university, our basic currency is knowledge. And we're very interested in the generation of knowledge, the mobilization of knowledge, and the uptake of knowledge in public policy. And that's really what we're trying to do as an institute. And the University of Calgary has invested in the creation of this institute. Our tagline as an institute is better health and healthcare. And that tagline you'll recognize speaks to both the healthcare system piece, but also the population health piece. And today, I would say the greatest focus of today's event is going to be on that foundational piece of population health. And I want to mention in our institute that we are very excited to have a new center that is co-led by my colleagues, Dr. Melanie Rock. Melanie, can you wave? And Lindsay McLaren. Normally they're joined at the hip, the two of them side by side, so maybe not here yet or tied up with. And so the new center is called the Population Health and Inequities Research Center. And this is a center that has a diverse group of faculty, very interdisciplinary, who are focused on ways to optimize health of the population. And in that Population Health and Inequities Research Center, we have some faculty members who are very active in their engagement with the City of Calgary. Melanie in particular, and also her colleague Gavin McCormick, who is doing work on the walkability of cities and how population health is influenced by urban design. So clearly these are individuals who are both instrumental to the preparation of today and the themes of today, but also are key to the partnership. As a university institute, we have a focus on many things that academics focus on, and many people talk about the academic bubble, and we live in a bubble, and we focus on academic successes, and we do live, we know that, in an academic world where we write articles for our journals. And the University of Calgary does have a focus on academic excellence, and some of what Ed spoke about really highlights the fact that the University of Calgary is achieving many successes in the academic realm. We in the Institute, though, are really inspired by a strategy that has been declared at the university as Eyes High. And I don't have to say much. Eyes High is a very good metaphor for what we're trying to achieve at the University of Calgary. And part of Eyes High is to be outstanding in a number of academic metrics that would show on a national stage that we're a leading academic university. But the second part of Eyes High is a focus on producing societal impact, community impact. And foundational to that is partnerships. And Ed spoke of partnerships. And today really showcases three strong partnerships that we have formed over time in the Institute. The first is a between faculty partnership that we're so excited about with environmental design. And Nancy, John Brown, the Associate Dean Research of Environmental Design, is not here, but he's been a big catalyst of this partnership. And I think you'll feel the energy of the partnership that we formed with a sister faculty. The second is Alberta Health Services, and we have our colleague Andy Patullo, who will be speaking later today on the upstream doctor and the concept of physicians. I myself am a physician, so I look after people when they're sick, but the notion of being an upstream doctor is to be attentive to population health, and Alberta Health Services is an upstream health organization that is striving to think of ways to help keep us healthy. And then the third big partnership that will be showcased today is that with the City of Calgary and the Urban Alliance, and I'm very excited about the potential. We clearly have a city that is receptive to the themes that are going to be discussed here. And one of the early links to our institute was a visit from Mayor Nenshi to the Faculty of Medicine, where there was an explicitly stated receptivity to our engaging with the city on scholarship and partnership to produce a healthy city, a better city. So I'll just close by saying, really, these are exciting times. We're in a very dynamic city. That's very clear. We work, those of us who are in the university, in a very dynamic university. And I will just say, Dr. McCauley, our VP Research, part of the reason it's such a dynamic university is we have such dynamic leaders like Ed. And foundational to all of this is the partnerships that are on display. The last thing I'll say is I'll just thank, again, the sponsors of today, who are the partners: Alberta Health Services, the City of Calgary, the university, and also from government through Alberta Innovates Health Solutions, considerable funding that has made today possible. So thank you for all that.